Hello, dear students. How are you all? Hope you are doing good. Today, we are going to discuss about type 1 hypersensitivity reaction. Before that, as an introduction, we will discuss what is hypersensitivity, what are the different types of hypersensitivity, then what is type 1 hypersensitivity, mechanism of hypersensitivity, what are the diseases associated with type 1 hypersensitivity, then what are the tests to detect type 1 hypersensitivity, and treatment strategies for type 1 hypersensitivity. So as an introduction, we will move on to hypersensitivity reactions. So what are hypersensitivity reactions? Hypersensitivity reactions, these are allergic reactions. All of us know these are allergic reactions. These are exaggerated inflammatory response which cause extensive tissue damage or sometimes even death. The term hypersensitivity or allergy refers to injurious consequences in the sensitized host following subsequent contact with specific antigens. So here we should learn that hypersensitivities are exaggerated inflammatory response. They are not normal inflammatory response. They are exaggerated inflammatory response which causes extensive tissue damage, and it occurs in sensitized host following subsequent contact with specific antigens, not with initial contact, following subsequent contact with specific antigens. So, according to Gell and Coombs classification, following an antigen contact, hypersensitivity may occur immediately or late after a few days. It may result from abnormality of either humoral immune response or cell-mediated immune response. All of us know humoral immune response are mediated by B cells and cell-mediated immune response are mediated by T cells. So, according to Gell's and Coombs classification, there are 4 types of hypersensitivity reaction. Type 1, that is anaphylactic hypersensitivity, otherwise called IgE-mediated hypersensitivity. Type 2, cytotoxic hypersensitivity, otherwise called antibody-mediated hypersensitivity. Type 3, immune complex-mediated hypersensitivity. And the last one, type 4, that is delayed type hypersensitivity. So next, we will move on to immediate hypersensitivity reactions. Reactions that occur immediately within few minutes to few hours of antigen contact as a result of abnormal exaggerated humoral response or anti-mediated response are called immediate hypersensitivity reactions. This type 1, type 2, type 3 comes under immediate hypersensitivity reactions. Type 1 is IgE mediated, that we already said, which caused mast cell degranulation following contact with antigen. That is a mechanism there. Type 2 hypersensitivity, that is IgG mediated, which cause complement activation or antibody dependent cellular cytotoxicity. Type 3 is immune complex mediated, interaction of antigen and antibody resulting in abnormal inflammatory response. So this type 1, type 2, type 3 are immediate hypersensitivity reactions. Next is delayed type hypersensitivity reaction, that is type 4 hypersensitivity. Delayed type hypersensitivity reaction occur after a few days of antigen contact as a result of abnormal cell-mediated immune response. We already said type 1, type 2, type 3 are mediated by humoral immune response and type 4 is mediated by cell-mediated immune response. This type 4 is mediated by a subset of T helper cells. So next we will move on to our topic, that is type 1 hypersensitivity reaction. This is a pictorial representation of this type 1 hypersensitivity reaction, that is IgE mediated hypersensitivity reaction. So, as all of us know, plasma cells secrete IgE on exposure to antigen. This IgE binds to Fc receptors on sensitized mast cells and blood basophils. We already discussed this is due to the mast cell degranulation. Okay, so this IgE will bind to the Fc receptors on sensitized mast cells. On re-exposure of the allergen, it cross-links the IgE and causes degranulation, releasing granules. So mediators within these granules act on the surrounding tissues such as smooth muscle, small blood vessels, and mucus plate. Chemically active effectors within these granules released via degranulation are called mediators. So examples for such kind of mediators are histamines, serotonin, leukotrienes, prostaglandins, and cytokines. So this is the mechanism. So mechanism of type 1 hypersensitivity reaction occurs through two phases with an interval of 2 to 3 weeks. First phase is the sensitization phase, that is the first exposure of individual to sensitizing dose of allergen. Most effective when the allergen introduced parenterally, ingestion or inhalation, and minute quantity can sensitize susceptible individual. Allergen is processed by antigen presenting cells, we all know earlier, and these antigenic peptides are presented to CD4 helper T cells. So what happens? Activated T helper cells will differentiate into T helper cell 2 cells, which in turn secretes interleukin 4. This is the crucial step in this phase. Interleukin 4 induces B cell to differentiate into IgE producing plasma cells, that we already said that these plasma cells will secrete IgE. Fc region of the secreted IgE binds to the Fc receptors on mast cells. Such mast cells are called sensitized mast cells, that is IgE coated mast cells that awaits for subsequent antigenic exposure. Next phase is the effector phase, that is upon second exposure of the same allergen, that is called shocking dose. It directly binds to the FAB region of IgE coated on mast cells, that is sensitized mast cells. So what happens? This IgE cross-link triggers the mast cells and basophil activation and degranulation, leading to the release of, that we already said, what, pharmacologically active chemical mediators, leading to different mechanisms or manifestations. So degranulation of mast cells and basophils occurs in two phases. Primary mediators are released. These are pre-formed chemical mediators like histamine and serotonin that are immediately released. Secondary mediators, examples are prostaglandins and leukotrienes that are synthesized and released by mast cells. So what are the effects of this mechanism? Vasodilation and increased vascular permeability and inflammatory cells attack the pathogen. Epithelial damage, bronchoconstriction, and inflamed bronchial tubes leads to breathlessness, hypertension, and shock, leading to death. So, we all know that there are two phases in the mechanism of type 1 hypersensitivity, that is effector phase, sensitization phase. Sensitization phase is the first step that occurs due to the initial contact of the antigen. Effector phase occurs due to the re-exposure of the same allergen. So, as a result, mast cell degranulation occurs and chemical mediators are released. So, certain clinical manifestations are associated with type 1 hypersensitivity reaction. This include immediate manifestations and late manifestations. Immediate manifestations, the important one is anaphylactic shock, that's a systemic manifestation which causes severe dyspnea, hypotension, and vascular collapse leading to death. Atopy, that is a localized response. That is, the reaction is confined to specific target site or organ, mostly epithelial surface at the entry of allergen. Example for atopic reactions are allergic rhinitis, most common atopic disorder due to exposure to airborne allergens, conjunctiva and nasal mucosa. Increased mucus secretion, nasal mucosa, and upper respiratory tract along with sneezing and coughing. That is allergic rhinitis. That is an example for atopic reaction. Asthma, involvement of lower respiratory tract mucosa leading to bronchial smooth muscle contraction, and airway edema, excess mucus leading to bronchoconstriction and dyspnea. Two types are allergic and intrinsic asthma. So these are atopic reactions. So next is food allergy. That's also a type of type 1 hypersensitivity. Food allergens stimulate mast cell lining gut mucosa to cause diarrhea and vomiting. Allergen can be transported to distant sites like skin to cause atopic urticaria. Atopic dermatitis or allergic eczema. This is an inflammatory disease of skin, mostly in infancy, manifesting erythematous skin eruptions filled with pus. Drug allergy. Drug like penicillin, sulfonamides produce local or systemic anaphylaxis. So, under clinical manifestations, immediate manifestations are anaphylactic shock, atopy, food allergy, atopic dermatitis, and drug allergy. Then comes late manifestations. So, as per the name itself, the inflammatory response occurs after 4 to 6 hours and lasts for 1 to 2 days, leading to tissue injury. So already we discussed the mediators are there. Along with that, certain cytokines, interleukin 3, 5, 8, eosinophil chemotactic factor, neutrophil chemotactic factor, recruits various inflammatory cells like eosinophils, neutrophils, macrophages, and lymphocytes, leading to inflammatory influxes. Such inflammatory influxes include eosinophil influx, which cause the release of toxic granules from eosinophils, leading to persistent asthma due to chronic inflammation of bronchial mucosa. It is favored by ECF, IL-15, GM-CSF. Neutrophil infiltration occurs by the release of various mediators, leading to inflammatory tissue damage and thickening of basement membrane. It is induced by interleukin 8. So, what are the factors that affect this type 1 hypersensitivity? One is the genetic makeup of an organism or an individual. Second is allergen dose. How much allergen enters to our body? That is allergen dose. T helper cell 1 versus T helper cell 2 response. Whether this T helper cell 1 response occurs or 2 response occurs. These all are the factors affecting type 1 hypersensitivity reactions. So, this is the table showing some common allergens associated with type 1 hypersensitivity reaction. So, proteins like foreign serum vaccines, plant pollens of ryegrass, ragweed, timothy grass, bush trees, drugs like penicillin, sulfonamides, local anesthetics, salicylates, certain foods like nuts, seafood, egg, pea, beans, milk, insect products like bee venom, wasp venom, ant venom, cockroach calyx, dust mites, mold spores, animal hair and danders. These all are the common allergens associated with type 1 hypersensitivity. So next, certain experiments are there in early days to demonstrate type 1 reaction. One such experiment that we have conducted in vivo is PK reaction, that is Prosnis-Kursner reaction. And these two scientists in 1921 injected serum from an allergic person to a non-allergic individual intradermally. So later, when the appropriate antigen was injected at the same site, a wheel and flare reaction developed at the site, demonstrated that antibodies in that serum are responsible for allergy and is transferable from one person to another. So wheel and flare response occurs in 3 stages. First, they begin with the appearance of an erythematous area at the site of injury, followed by the development of a flare surrounding the site. Finally, a wheal forms at the site as fluid leaks under the skin from the surrounding capillaries. And it was found that the serum factors responsible for this reaction is immunoglobulin E or IgE. Thus, they proved that corresponding wheel and flare response is due to type 1 hypersensitivity reaction. Then, to detect type 1 hypersensitivity reaction, certain tests are there. First is skin prick test, that is, allergens introduced by intradermal injections or superficial scratching on different sides of skin. Allergic person develop a local wheel and flare reaction within 30 minutes at inoculation site. So advantages of this test is screening large number of allergens at one go. Another test is radioimmunosorbent test, RIST, highly sensitive technique to detect total serum IgE antibody using a radio-labeled anti-IgE. Radioallergosorbent test, RAST, quantifying serum level of allergen-specific IgE. So these are the tests for the detection of type 1 hypersensitivity reaction. So what are the treatment strategies for this type 1 hypersensitivity reaction? Practice better dose control, immunotherapy, monoclonal anti-IgE, that is humanized monoclonal anti-IgE can bind and block this IgE. So if IgE is released, that only will bind with the mast cells and causes mast cell degradation. So we are giving a humanized monoclonal anti-IgE that can bind and block the IgE. Antihistamines blocking the binding of histamine on target cells. So these are the treatment strategies we can adopt to treat this type 1 hypersensitivity reaction. So this is the pictorial representation that explains type 1 hypersensitivity reaction. That is antigen or allergen, which when enters the cell, B cells will secrete what IgE antibodies. This IgE will bind to the surface of mast cell or basophil, that is a sensitization phase. On subsequent exposure of the same antigen, what happens is antigen bridges the gap between two antibody molecules. Degranulation of the cell and release of histamine and other mediators happens. Histamine increases the permeability and distension of blood capillaries, causing vasoconstriction and all. Constriction of bronchioles, leading to shock and death. So this is all about type 1 hypersensitivity reaction. Students, I think you understand the topic. So as a conclusion, we had discussed what is hypersensitivity, what are the different types of hypersensitivity according to Gell and Coombs classification, what are immediate hypersensitivity reactions that are type 1, type 2 and type 3. Delayed type hypersensitivity reaction is type 4. Type 1, type 2, type 3 reactions are due to the abnormality in humoral immune response, while type 4 is due to abnormality in cell-mediated immune response. Then comes the type 1 hypersensitivity. Mechanism of type 1 hypersensitivity occurs in two phases, sensitization phase and effector phase. So first initial contact of antigen occurs. What happens? This antigen is presented, antigen is processed, and it is processed to T helper cells. T helper cells will get activated and differentiate into T helper cell 1 that in turn release interleukin 4 that will differentiate B cell. B cells will differentiate into plasma cells. Plasma cells will secrete IgE antibodies. This IgE will bind to the Fc region of mast cells. That is a sensitization phase, and mast cells get sensitized. On re-exposure of the same allergen, what happens? The allergen will bind to the FAB region of IgE-coated mast cell, causing mast cell degranulation, so that as a result, chemical mediators are released like histamine, serotonins. These are primary mediators. Prostaglandins and leukotrienes are secondary mediators. So what are the clinical manifestations that we discussed? Immediate manifestations and late manifestations. Immediate manifestations include anaphylactic shock, atopy, food allergy, drug allergy, atopic dermatitis. Then late manifestations are due to the release of mediators. Along with the mediators, certain cytokines which will recruit eosinophils and neutrophils, which will cause extensive inflammatory responses. Next, we had discussed the experiment to demonstrate type 1 reaction, that is PKD reaction, which they had conducted in vivo. After that, what are the tests to detect type 1 hypersensitivity reaction, like skin prick test, wrist, and RAST. And at last, we concluded with the treatment strategies for type 1 hypersensitivity reactions. Students, hope you all understand the topic very well. See you in the next class. Thank you.